Welcome to WFR Aquaplast Corporation's Cranial Spinal Axis Treatment instructional video using the AccuFix cantilevered system. The patient is first placed in the supine position on the AccuFix base on an appropriately shaped Silverman headrest. Next, slide the AccuFix prone mask holder onto the AccuFix's white index pins. Adjust the height of the prone mask holder so that it is at the same height as the forehead and parallel to both the forehead and cheekbones of your patient. The nose should slightly protrude through the top of the upper base plate of the prone mask holder. Adjust all 4 support discs to be in direct contact with the upper base plate. With the patient's head set straight, place the U-frame on the hip opposite to your stretching hand and pre-stretch the mask approximately 6 inches as demonstrated. Place the mesh on your wrist to check the temperature of the mask mesh. If it is comfortable on your wrist, it is safe to place on the patient's face. Place the center of the mask mesh over the nose, forehead, and cheekbones of the patient. Verify that the material is evenly and symmetrically drooping over the nose and cheekbones. If an adjustment is necessary, there is plenty of working time to lift the mask off the patient and reapply the U-frame in a more symmetrical fashion. Once the mesh is in proper relation to the face, gently hold the softened material against the Nasion and nasal bones while the material cools. You may want to use a cold water soaked and wrung out towel technique to hasten the cooling of the material.
Help you up. There you go. Alright. You okay? Okay. Superimpose the foam.
A foam material is then cut to size and shape to make the mask comfortable for the patient. This is accomplished by tracing a semicircle that is slightly larger than the patient's forehead. The same may also be done for the chin. These 2 pieces are then cut out of the foam sheet and are applied to the mask. There is an adhesive backing to both of these pieces of foam. The AccuFix tilting base plate is attached to the AccuFix cantilevered base . You may determine that it is more convenient for staff to have an additional AccuFix cantilevered system permanently set up for prone use. The AccuFix tilting base plate is specially designed to accommodate 2 masks, and all of the angles are clearly visible on the arms of the tilting base plate when viewed laterally. The foam material is then applied to the prone mask . The frame is simply placed over the white index pins of the tilting base plate, and at this point, simply ask your patient to follow their nose right into an accurate and reproducible position for simulation and treatment. After the patient's head is in position, an optional second mask may be placed over the posterior of the head to help keep the head and neck straight during simulation and treatment. The ears may need to be adjusted. The swivel locks are then fastened down, and the patient is ready to proceed with simulation. The shoulders may also be pressed down to get better access to the lateral region of the patient's neck. Thank you for your time in viewing this instructional video. We hope you, like many others, have found this technique beneficial.